Hi, my name is Shelly Kading. I'm a student nurse with Northland. Tonight I'm going to be showing you the insertion, irrigation, and discontinuation of an NG tube. To begin, we want to prep our patient, explain the procedure to them. So first we're going to put this checked pad over our patient here. We want to make sure we give the patient an emesis basin in case they get nauseous, a box of Kleenexes, and a cup of water with a straw in it. So to begin, we'll put on our gloves here. Now to begin, we want to measure how much tubing we're going to need. So we want to measure from the tip of the nose to the tip of the earlobe, and then from the tip of the earlobe down to the xiphoid process. Then we want to take a piece of tape and mark that. So next we're going to lube up the end of the tubing, like 3-4 inches or so. Okay. Then next we're gonna insert the tube about 3-4 inches until the patient begins to gag. Then we want to pause for a little bit just to give them some time. And at this point, if we had another person with us, we'd ask that person to hold on to the water glass and, offer the patient sips of water. So then next as we're offering the patient sips of water, we're going to tell them to swallow as we insert the tube down their nose. So we're going to keep saying swallow, 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 swallow. Swallow, 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 swallow. Swallow, swallow, swallow. And if you hit any resistance, just twist the tubing. Okay. And once you've got far enough to the mark, we want to grab our piece of tape and we're going to tape it to the bridge of the nose. And then we can secure the tubing so it can't go anywhere. Okay. Then we're going to take a syringe here. We want to instill 5 to 10 cc's of air. And at the same time as we're doing that, we're going to listen for a swoosh. Okay, and if you don't hear the swoosh, we want to draw back and aspirate. And once we do that, we can clamp that off. Once we aspirate the contents of the stomach, we want to take it back and test the pH of it. We want it to be between 0 and 4. So we've tested that, then we can connect the patient to the suction machine. After we've connected the patient to the suction machine, we want to instill 5 to 10 cc's of air into the blue reflex air valve. just to make sure that we move everything away from the lining of the stomach. So we've done that. We can reapply the reflux valve. Now we want to make sure we come back and check on our patient to see how they're doing. So we'll shut off the suction machine. Then we're going to instill another 5 to 10, with a new syringe, we're going to instill another 5 to 10 cc's of air into the tubing to check the placement of it. Okay, so if we didn't hear anything in that, that means that there's a blockage somewhere. So we're gonna go over to our water, it can be tap water, and draw up 30 cc's of water. And then, while holding the tubing and the syringe, we want to pump it to get rid of that blockage until it goes through. Once it goes through, we can disconnect the syringe and we can reconnect the patient up to the suction machine. And once we do that, we can grab a new syringe. We'll disconnect the reflux valve and we're going to instill another 5 to 10 cc's of air into the reflux valve just to push everything away from the lining of the stomach. We'll replace that valve cap. Next we're going to discontinue. We've gotten the order from the physician to discontinue the NG tube. So we want to make sure first that when we come in and see the patient that we assess bowel sounds in all 4 quadrants. Okay, and once we've done that, we're going to check the placement again. So we're going to instill another 5 to 10 cc's of air into the tube. So we'll make sure we shut the suction machine off. Okay, and we'll listen. Alright, with that, once we inserted the 5 to 10 cc's of air into the tube, we want to make sure that we aspirate again to check the contents of the stomach. So we'll kink that off once we aspirate it a little bit. We'll take this back and we want to test it on our pH strips to make sure it's between 0 and 4. As long as that's okay, then we're in the stomach. So next, we're going to grab a new syringe. We want to irrigate. So we're going to draw back 20 cc's of air, and then we're going to draw up another 20 cc's of water. So the water is going to push everything through and the air is going to push the water through to make sure that everything is out. So we're going to push that through, and then we'll do the 20 cc's of air. And we want to leave this connected. Then we're going to tell our patient to take a deep breath. And then we're going to pull the tubing out and we're just going to fold it over and over. Okay, and we'll